What's going on, everybody? My name's Eli, and welcome back to my YouTube channel. So we're finally capping off the residency vlog series. Last but not least, in this episode of the series, we have a day in the life of a prosthodontics resident. For those of you who have been following my channel for a long time, you know that I always mention like removable prosthodontics and fixed prosthodontics in my vlogs. And this vlog definitely changed like my perspective on prosthodontics and the specialty in itself. Of course, before we get any further into the video, if you're new to the channel, my name is Eli. I'm a second-year dental student at Boston University. On this channel, I make vlogs with my dental school journey, as well as videos with advice for pre-dents. So if that's something that interests you, please make sure you subscribe, like the videos, comment on the videos, and share the channel with anyone else that might find it interesting. So in today's vlog, I have Dr. Bradley Eway. He is a first-year prosthodontics resident at the UT Health School of Dentistry in Houston, I believe it is. He takes you guys through his day and also talks a little bit about prosthodontics residency in general. For those that don't know, prosthodontics is the discipline of dentistry that focuses on prosthetics. So, you know, like in regular medicine, a prosthetic will be like a new leg, or a prosthetic leg. It's hard to define it without using it, but in dentistry, it's kind of the same thing. New teeth, which could be fixed in your mouth, like you can't remove it, or removable, like a partial denture or a complete denture. You can also have fixed prosthodontics, like a crown that's cemented onto your tooth, or a bridge that's cemented onto a few teeth, etc. So Dr. Eway takes us through a day of Prosth residency at his residence site or at his school. And I don't want to draw on the intro for too long, but I'll pass it on to Dr. Eway for a day in his life. And please enjoy the vlog.
How's it going, everybody? My name is Dr. Bradley Eway. I am a first-year Prosth resident at UT Health School of Dentistry in Houston. I previously attended Meharry Medical College, School of Dentistry, just graduated, and currently right now I am a Prosth resident. I would say what got me interested in being a Prosth resident was that Prosth is pretty much the specialty for cosmetics. It is the true end goal when it comes down to anything that is dental related. If anything fails, right, it most likely will come to a prosthodontist. And I'll say that if it comes to heroic dentistry, prosthodontics is the most heroic. If anybody messes up, it'll come in our hands. It may take a minute, but hey, you know, to give somebody the smile that they ever wanted, that's pretty much the goal. And man, this vlog stuff is hard. I don't know how people do this on a living, but kudos to y'all. When deciding what type of programs to join, I would say there's two sides to Prosth. There's the technological side and there's the traditional side. For me, I believe that you should try to find a good mix of both to try to get the old school techniques to try to apply it to the new school. So I try to look for programs who fit that bill. Some people like to go more of the digital route since that's more of the future, but at the same time, there's some prosthodontic residencies that have the old school ways and they stick and they're holding ground, which is also good too. But I believe that you should be looking for programs that are kind of moving towards that digital side that has still old school techniques, because when it comes down to the future of dentistry, digital is the way. But if you continue to rely solely on digital, you kind of forget the quality control when it comes down to finding out the correct occlusion, video, and other aspects when it comes down to somebody's dentistry. Another reason why I chose the program that I'm in today is because I'm back in my home city. Now I'm closer to my family, I could support them. At the same time, this is the place that kind of gave me a start. Actually piqued my interest in dentistry because my university is literally about maybe 8 minutes away from here at Texas Southern University. And I actually found a doctor who's actually at this institution who actually gave me the interest of becoming a dentist. And so it's crazy, full circle. But yeah, I love it here. The people, the atmosphere, right? Even especially when it comes down to the tools that they have here. Like, I'm so blessed that they're almost like I see nothing but milling machines, 3D printers. When it comes down to implants, we work with the top implant companies: Straumann, Nobel, BioHorizon, for bone graft, and other companies too that I can't ring a bell on that. ZimV, a lot of people are still familiar with that. There used to be Zimmer. What's another one? Man, but no, there's many. But becoming a prosthodontist, I learned that there's a lot of different type of dentistry, and to actually see what the end goal is, that's kind of pretty much what a prosthodontist is about. When somebody comes up to me and they say that they want a perfect smile, first we got to see if they're like, okay, cool, is it going to be a full mouth rehab, or is it going to be a denture or an over denture or a hybrid? And to get to that goal, there's going to be multiple steps that have to go through. When becoming a prosthodontist, it's heavy interdisciplinary, right? We are going to be working with perio residents like this. We have classes with them. Ortho residents, peds if you are, working with kids, and oral surgery when it comes down to multiple extractions. It really sees, and also endo too, when it comes down to trying to see if you can try to save or create a survey crown. But when it comes down to the end goal, I would say Prosth, in the long run, right, it's a very long process to get to the goal that you have set in mind. That's what coming from like learning here for about during my first year, I kind of understood the difference between somebody just coming to me and saying this. It's like, I just want a crown, and well, yeah, we could give you that crown. That's not a problem. But when it comes to the overall occlusion, your bite, your way of life, to make sure that everything is within good reason. And that's the main reason. That's another reason why I became a prosthodontist.
Just got out of class with the perio students. We have an implant lecture this morning. Them 7 o'clock classes, brutal, man. Brutal. But it was a good class today. We learned about socket preservations and all that. And so hopefully we'll see what's going to go on. There's supposed to be about maybe 3 surgeries today. And we're going to see if we can get some action. Stay tuned.
I think the tools for you to be a specialist in Prosth, it's too many. Oh, you wanna add to it? What do you think? What's it called?
Oh, you're recording me?
What do you think the tools it takes to become a prosthodontist?
No, wait. Let's recap one more time.
Okay, man. What tools do you think is necessary to become a prosthodontist?
To become a prosthodontist, that's a good question. Man, you gotta be patient. It's a very steep learning curve. You've got to learn all of your lab work. You've got to learn all of your dental material. You got to master occlusion. It's pretty much you got to master everything in dentistry, I think. So just be patient, read as much as you can, and you'll be successful.
Man, you heard it here, people. You heard it here. When it comes to Prosth, man, who out there does their lab work and all their lab work, right, and quality control? Nobody else but a prosthodontist, right? Ah, man. Said from the truth right there.
So what does it take to be a prosthodontist? I think you gotta be organized, okay? You need to be like the mastermind. If you are usually like the mastermind of things, that's what you need, because a prosthodontist is like the mastermind of the treatment plan. Once you get into that mindset of being a planner, then that's what it takes to be a prosthodontist. And besides that, just be very organized and willing to work with all different types of population, particularly to the elderly, because that's a big population that we treat. But yeah, I think that's what it comes to my mind. Okay.
I'm loving it. I'm loving it. Yeah, that's my third year. She's leaving great. One of the masters right there. Third year right there, man. Smoke it true. Y'all have it there, folks. I don't know what else to say.
Oh. Well, today was interesting. About 2 patients canceled. We did 1 socket preservation. Not too bad. A little bit light today. I wish it was something more interesting. And also, I kind of wished I could show y'all what actually happens in the chair, but we didn't get clearance for that. So it's all right, guys. I'll try to see if I can try to get clearance for one of my patients. But other than that, it's been I'm about to go home, get me some food, and then come back up here around 7 and get back into the lab. All right.
Go ahead and say hi for the camera. This is where the magic happens. This one right here is 2nd year. Ellie, the magician. Right, look at her. Look at that. Look at that. That's that digital workup right there. Look at that. Okay. What you doing right now, Ellie?
I'm adjusting occlusal guard for the patient.
Okay. Yeah. Let me go ahead and get started with mine too. Yeah, we're gonna try to see if we can try to help Brody out. I can't see nothing right now. I don't know how to use these new technology. It's another one of my patients. This Mandela. Nice and sealed. We gotta keep it right. Oh. Look at that shine. Look at that shine, man. Look at that shine. Glistening. So this is just a few of the patients that we already have handled. Right, see that's my friends right here. Going right here, and then we have to do the lab work and mark up for all these cases. This is Natalie's case. As you can see, she be in it. She be in it. We just started, so I just got maybe 15 cases right now. And hopefully we could get up to a 3rd year status and see what's going on. Just made it out the dungeon. About to decompress, go home, do a little review, and call it a night. It's dark, it's like barely anybody. Go home.
All right, so that was definitely an interesting vlog. One thing I noticed that was different about the prosthodontics residency that didn't seem as prominent in the other residencies is, like he said, who does all of their lab work on their own, all the quality control, all that stuff. So you can definitely tell that there's some long days in a prosthodontics residency after seeing patients. You gotta go to the lab in a few hours. You can see how dark it was when Dr. Iwe left. And yeah, definitely a demanding residency. However, I'm sure it's very rewarding, especially for people that are interested in doing like full mouth rehabs, making over people's smiles, things like that. Definitely some reasons why people would want to go into a prosthodontics residency. Aside from that, this will be the last episode of the residency vlog series. And I do have a new series coming very soon. I need you all to mark your calendars right now. Friday, April 21st, I will be releasing a video at 12 o'clock noon Eastern Standard Time. That is my 2-year anniversary on YouTube. I have some very special announcements coming in that video. I don't want y'all to miss them. Other than that, I thank you all for watching all of the videos in the residency series. I hope you did get to watch all of them. And I hope you enjoyed them, and I hope you got something from them. And maybe it helped you narrow down some residency programs that you may be considering, or you may have ruled out some from the videos. Who knows? Anyway, I'll see you guys in the next video. Thanks for watching. And again, don't forget to subscribe and share the channel with anyone else that might find it interesting. Peace.